live can view this on YouTube at a later time. Okay, so hi everyone. Once again, welcome to the INFUSE 2024 Call for Innovators Info Session. My name is Sheila Otieno. I'm a program manager from Seedstars. At Seedstars, we believe in impacting people's lives, and it is in this regard that we are supporting Gavi, the Vaccine Alliance, with this global call for application for innovators and innovative solutions that are uniquely positioned to enhance health systems, enabling them to effectively manage resilient and climate adaptive responses to climate threats. In this call, we have the team from Gavi, Bertrand and Sarah. I don't know why, yeah, your name on the screen, we can still see Sarah, but I'll try to rename you. And I'm going to be handing over to you, Bertrand, so that you can take us through this presentation. Then we can answer questions. Please feel free to type the questions in the chat box, even while the presentation is ongoing, just so that once we are done, we can kickstart answering them. So thank you so much, everyone. Handing over to you, Bertrand. You're muted, sorry. I don't know if you're speaking, but you're on mute.
Okay, there we go. So, hi everyone. Thank you, Shida, for the introduction. I'm Bertrand Bersen. Indeed, I think there's a bit of a glitch on my name, but we'll correct that. So I'm the INFUSE lead at Gavi, the Vaccine Alliance, and I'm really pleased to be here with you to talk in more details about INFUSE, about Gavi, about INFUSE, and about the INFUSE 2024 call for application. So let's get it started. You showing the slide? Okay, let's go on the slide. What is Gavi, first of all? So Gavi is the Vaccine Alliance. It's a public and private partnerships that help vaccinate more than half of the world's children against some of the world's deadliest diseases. And as a Vaccine Alliance, we bring together developing countries, donor governments, the World Health Organization, UNICEF, the World Bank, the vaccine industries, technical agencies, the civil society, the Bill and Melinda Gates Foundation, private sector partners, and you innovators that can help on our mission. So it's a big family, as you can see. So far, Gavi has already helped vaccinated half of the world diseases, as I mentioned, and has already protected an entire generation because we were launched in 2000, so it's been 4 years now that we are working the generation after generation. So we're moving to the next generation now. After 2 decades now, we are looking at supporting kids around the world. We have covered 78 lower income countries since our inception, and for the current 2021-2025 period, we are covering 57 countries. What is very important is on the next slide is basically our impact so far. So we have reached 1 billion children in that time, saving 17 million lives. And beyond the health impact and the life saved, there's also an economic impact. As the children become healthier, their families, their communities are all able to also economically be more prosperous, more socially stable. And one number that I particularly keen to share with you today is that for every dollar spent on immunization in the Gavi-supported countries, $21 are saved in healthcare costs, in lost wages, in lost productivity. So really a broad impact. And that led us to generate a positive impact of economic benefits up to 220 billion in USD. So really a wide, not only health impact, but also economic and social impacts. On the next slide, we'll see how Gavi is working with the private sector. So we work with the private sector based on 2 main pillars. The first one is engaging with what we can call industry leaders, the big name of this world, who are supporting our mission, and we're very grateful for their support. And we basically leverage their expertise, their international reach, and put basically the wealth of their knowledge on the topic they are supporting us with to improve our immunization program. And then we also stand on another pillar, which is the one where Infuse is really keen to seek innovation. It's basically the groundbreaking solution that can really shape tomorrow's industries and tomorrow's, especially on the focal area that we have. So here we've identified supply chain, data, demand as being very key to our mission, and looking at innovators that can help on those topics. So we're moving on towards Infuse and Infuse 2.0. So let's say a few words about Infuse. We started in 2016 with the first Infuse call for application. That was launched in the World Economic Forum with the objective to connect high impact innovation with the country that needs them the most. And so we'll go in more details about how we do that, but we basically infuse the innovators with capital, with expertise to help that mission. And this Infuse call for application and Infuse innovation platform is really rooted in one of the first flagship partnership that we had with Zipline back in 2016. We started working with Zipline in Rwanda, which is a country really being famous for being the country of the Southern Hills, so leading to many hard-to-reach community. And on the other hand, we had Zipline with a drone delivery service that could really change the way we bring immunization to those hard-to-reach community. So putting the two together really meant that Rwanda became the first country in the world with a commercial drone delivery service. So that was what made us thought, there must be some other Zipline in this world. And by the way, since then, Zipline has grown into a tremendous success and has now a 4.5 billion valuation. And so we're looking for the Zipline of tomorrow and help them scale throughout the world. So on the next slide, you'll see the global footprints that the Infuse has with what we call our pacesetters. That is the innovators that have gone through the process and successfully been selected. And you'll see that we are working in all the region and country that Gavi is supporting. So that include Africa, but also Asia, particularly Southeast Asia. So we're not limited by a country, by a region, and we're looking to implement the solution that we identify on the country that need them. So obviously you still have those SFA, the strategic focus area that Gavi has, so demand generation, data and supply, and really a mix of those three SFAs are covered by the innovators we have identified so far. On the next slide, you'll see a past call for application. So what have we been looking for in terms of solution? So the thematics can be really specific to a technology like we had on identification and registration on the biometric side. It can be transversal to transversal technology and enabler like data. And it can also be more on a geographic challenge like urbanization. So saying a couple of words on data, it's obviously everywhere. It's one of the strategic focus areas you've seen. The question for us was, how can we gather those reliable data in a very systematic way, but also make sense of the data, understand it, and be able to take action on those data? In terms of the identification, it was really tackling the issue of finding, identifying, registering vaccine beneficiary along the whole cycle, but also starting at a young age, because obviously Gavi is looking at young children. In terms of urbanization, well, it's a clear challenge now. More than 57% of the global population is living in urban settings, and that can also create very difficult and very specific environment to reach children. On the next slide, we'll see that and a very important aspect is how has our pacesetter benefited from our supports? And one aspect is how we help them fuel their growth. And to be very clear, the credit is all there. There's a real mix of talent, efforts, of skills on their end that really made it possible. But working with Gavi was helpful in terms of enhancing their credibility, providing a proof of concept in a Gavi-supported country that also enabled them to further attract investors. So this really showed that global health can also be a market for impact investors. And some of those deals were also brokered with Gavi and by Gavi. On the next slide, you'll see also another way we engage with the pacesetters, and that is matching them with the powerhouse that we mentioned, those industry leaders that we mentioned. So, for example, Simprints is a biometric company that had an amazing hardware, but was struggling to really have a high accuracy on the fingerprints of young children. As you can imagine, the tissues on their fingerprints are a bit softer, and NEC had a solution to really help them in terms of authentication algorithm, work together to deploy the world first scalable child fingerprint identification system. And drone and logistics, so we mentioned already Zipline, and actual match between Zipline being really a disruptor in the supply chain in the drone delivery world, matching them with UPS, who has all the knowledge in the world about logistics, making sure the cold chains remain safe, and ensuring the on-time delivery as well. So pairing those two companies was absolutely beneficial. Nextleaf is a remote temperature monitoring device, or they are building RTMD, remote temperature monitoring devices, and that creates a lot of data, making sure that the fridge, the transportation is safe and within the temperature needed. And obviously, all those data is extremely valuable. And if there's one company that can handle big data, that's arguably Google. And that's why the pairing was absolutely natural between the two. On the next slide, we'll focus on the climate change and specifically the 2024 call for applications. So how can we bring together climate change and health system? So obviously, climate crisis, it's everywhere. It's one of the biggest threat for humanity, but also a huge health threat for humanity. It has significant implication for vaccine preventable diseases, for immunization program that we as Gavi run and will continue to do so. So the climate change crisis is really acting as an accelerator of the current issue that are faced by the health system, and also brings new one, as it can be vaccine preventable diseases, that the risk of occurrence increase with climate events, putting the population at higher risk. It can be also emerging diseases or pandemics. Well, we're not going to talk about pandemics here. I think we all have experienced that in the last years. It can be extreme weather that occur also more regularly, skyrocketing to more outbreaks. So how can we anticipate those? And it can be about pandemic level outbreak, as we've seen. Obviously, there's no vaccines against climate change, but there are vaccines against some of those climate sensitive diseases. And that's what we also want to make sure, be able to identify how those vaccines can help. And so another aspect that is very important to Gavi is the concept of zero-dose children. So the zero-dose children are children who have never received one single dose of vaccines, and they're often very clustered in vulnerable and marginalized communities that are less resilient to the impact of climate change. And obviously the climate change impact is falling really disproportionately on those marginalized communities, leading to more migration, displacements, risking to reduce the access to routine immunization, having direct damage to the health system. And so that's what we're looking at. How can we solve those issue, right? And we've identified three large families of application, if we can call it so. The first one is the green healthcare solution. So how can we mitigate our impact? And that would be the innovation that can help us reduce our energy consumption, our emission, but also taking care of this aspect of waste management that the second aspect is more the question of skills. How can we build the capacity with the healthcare workers who play an essential role for healthcare? They're also seen as a trusted source of information. Is also on climate-related topics. So how can we provide them with the right tools, incentives, resources to empower them efficiently? And finally, the last point is, can we anticipate it? How can we build climate resilient vaccine distribution? So we know those health impacts, those climate impacts will be directly changing the way we should be delivering immunization program. So how can we ensure we still have the ability to reach potentially displaced population, especially those who have chronic fragility or are under very acute emergency settings, and so helping us to anticipate the impact of climate change. So that's it in a few words for Infuse, Gavi, and the call for application. And very happy to start with the question.
Thank you so much for the presentation, Bertrand. I know for everyone that's watching, that is a lot of things. So if you have questions, please feel free to raise your hand or also to type it in the chat. But in the meantime, while we are thinking, we're going to go through a few questions that, frequently asked questions that we're getting in our inboxes when sending this information out. And I think what's on everyone's mind is this very first question. So we'll start with it. To you and Sarah, what kind of support and resources can the selected startups expect to receive from Gavi and its private sector partners?
So to make it very simple, we mentioned capital and expertise. And so basically, when they apply to Infuse, the pacesetters, the selected innovators, will really be entering a community of high potential innovators that have the opportunity to work closely with Gavi, but also with the country that we support to accelerate and scale their innovation. So with the program, they will really benefit from the Vaccine Alliance network, but also its expertise in global health and its unique connection also in country with the right person, with the Ministry of Health, with the EPI. And that is really the case to build that first proof of concept that we can do together. And we will also help them secure the resources and the expertise they may need to go to scale. One example, obviously, the resources can be purely financial. We provide financial supports depending on the pilot, so depending in which country, depending what will be the scope. So it's really hard to pinpoint one key amount, but we will shape that together once selected. So they will have the opportunity to work with Gavi to develop that plan of acceleration. They will be interfacing with with Gavi to really understand how their innovation can be adapted, can be tailored to specific country needs. The most promising one may also receive interest from our private sector partners, as we've seen in previous examples. So pairing those industry leaders with those promising innovator, they will have a dedicated focal point within Gavi to really engage with our full network. And I mentioned that Gavi was an alliance, so it's not just us in this building, but really looking at the wider alliance. And of course, they will have some visibility in our blog, the Vaccine Works blog, on our website, on our social media, and in other network or events that we are part of.
Thank you so much, Bertrand, for that. I think to summarize it all, you're going to be gaining, the access to Gavi and the whole of Gavi's network, and the alliance, not just Gavi. So the Vaccine Alliance, their network, and there's also potential to receive financial money, literally, because I know that's what everybody is asking about. So maybe you can
it's
give
part
us.
of it. Yeah, it's
Yeah,
part of
it's
it, but I
part
don't
of
want
it.
to put the spotlight only on this because it goes way beyond that. And another aspect that is really important to me and I really appreciate is to see pacesetters starting to work together. Infuse is really a community, so we really enjoy to see our pacesetters seeing an opportunity to collaborate together and develop a new solution, get to the next stage by collaboration.
Thank you so much. So one more, it's collaboration. You get to meet different people who are working on the same thing as you and get to learn from each other. I will say it again, feel free to raise your hand, ask questions. We're still going to go through other questions that we received while sending this application out to everyone. And the next one was, what are the acceptable solutions? From everything, this seems very niche when we are talking about intersection of climate and health, and everybody's thinking, okay, my solution may not exactly be this. They're looking for something very, very specific. So please elaborate. I know you've talked about it, kind of touched on it, but just please elaborate on this. Thank you.
Okay, thank you. I think it's a very important point indeed. So I've mentioned those three categories that were really driving the call. So the greener healthcare solution, frontline health workers solutions to empower them, having a distribution for or anticipating disruption from climate change to build those resilient vaccine distribution. But we're really open, actually. We don't know what we don't know, is the sentence that we sometimes use. We want to see those solutions that can help us and potentially adapt them. And if 7, 8, 9 years ago, when we started working with Zipline, you were telling me that drone would be a solution to vaccine, many of us would be quite skeptical, but actually it has been a tremendous solution. We've delivered 15 million doses of vaccines just by with drones. And similarly, there's a lot of solution where fingerprints and a vaccine, that shouldn't be something that you would think of as a first aspect. So what I want to say is really encourage anyone to apply and tell us, how do they see that their innovation can actually be useful? We don't know it all, obviously, and we'd love to use the creative power, the brains of the community to help us in those challenges.
Thank you so much for that answer. We don't know what we don't know, so we are out here looking for innovations that can solve this particular problem that has been identified. And we have 2 questions in the chat. I'll read through one from Philip. Hi, thank you for the presentation. Can you elaborate on the application process? What do you need? How long does it take? Also, can you say again what you're looking for in this call for application?
That's a lot of questions.
Yes.
Thank you, Philip.
Very good question.
So we've tried to, obviously we know the innovators, the entrepreneurs, they don't have a lot of time to dedicate to all the calls that are out there. So we're trying to keep it rather simple and straightforward. We may come back if we have a need for more details, but you'll see that the intake form is rather straightforward. So the process in terms of length is I would say quite rapid. Then comes the part of our time to work is to assess those innovation, and that will take a couple months, maybe 2 to 3 months, I would say, taking us to early summer, late June, early July, most likely, where we'll have that kind of exercise of shortlisting a set of companies and then bring them together through a workshop, a selection workshop, top 10 companies through a selection workshop to present, have the opportunity to present the solution and get selected by our jury. And so what are we looking for in those call for application? I think apart from what we've already mentioned in terms of solution, another aspect that we're looking for is companies that already have some kind of track record. We're not looking for someone with just an idea, just a prototype. I've mentioned the breadth of Gavi's footprints in so many countries that we need to be able to have companies that can be quick to respond to that. Obviously, you will not be introduced in 50-something countries right away, but ultimately, that's the goal for us to see the innovation we bring, having a clear pathway to scale with Gavi and to have an impact at a wider level. And I hope that answers the question to Philip.
Yes, Philip, if it doesn't answer or you have any follow-on questions, please still feel free to type it in the chat or raise your hand. And the next question that we have from the audience is, we are working on finalizing the application form. Should we specify target countries and write down the detailed reasons for that selection?
Right. So the countries, they are available online, and we'll put somewhere in the chat a link to where you can find them. But beyond that, I think it's basically very important that we're having a set of country that we support. So that's what we'll share. On top of that, in that list of countries, we will be working together to identify which one is the most important. So you don't need to specify, I want to work in XYZ country, but more how your solution can support in a general way, and we'll find a country that would benefit the most from that solution.
All right, thank you. So short answer, you don't need to specify. There's a list of countries that Gavi works at, and an assessment will be made to see where your solution can be scaled. Thank you so much, Sarah, for sending the list of countries supported by Gavi in the chat. Everyone, please click on that and you can, look at the list of countries. The third question that we were getting most in our emails was, I think we've talked about it, the benefits of the program for the selected applicants. So we'll move forward to the next question, which is, are there any specific types of partnerships and collaborations that INFUSE is particularly interested in fostering between the startups and your network? So I guess we are repeating, but either way, please just specifies if there's any form of specific forms of collaboration that you are looking to foster.
I think it's all about scale. Repeating myself here, but it's really about that. So if we can help a company be powered through that learning stage by pairing them with a large companies, for example, that's great. So that's the type of collaboration is one example. The other example is we've seen pacesetters who saw complementarity within their solution and thought that together they will be stronger and really revisited the solution and work together. So that's something also that we can see as collaboration. The third one is also really being ingrained in the country that we support. So it can be with the civil society organization, it can be with the accelerators or incubators they work with, or other entrepreneurs they work with as well. So really a wide area of potential collaboration. And if you have an idea that is groundbreaking and that you would like to include in your application, we're all yours to hear that.
Thank you so much for the answer. So there's very different types of collaborations that can come out of this. And if you have ideas, feel free. We are always open and willing to listen to you as well. The other question that we get asked is something that has been answered already about the regions and countries that the innovations are most needed. So let me see if there's any other question in the chat. No, there isn't. I think maybe we go to any final words that Bertrand you'd like to say, anything to the attendees or anyone that is going to be watching us live later on, not live.
Absolutely. First of all, really appreciate the enthusiasm that we see in supporting Infuse. It's been the first call was in 2016, so it's been a long ride, but really a successful ride. We really are so happy about the community that we've built, the engagement that we see, and beyond working with us, it's about supporting the mission that is, I would say, quite a noble cause that we work for. So first of all, that's the first aspect. The second aspect is we remain always happy to respond to our additional question, and you can reach out to us on our email. So the Infuse mailbox, it's called Infuse, INFUSE, obviously, at gavi.org, so GAVI.org or org. And we'll put it in the chat as well. And so feel free, if you have another question, feel free to come to us. And another piece of information that I think is quite important is the deadline is tomorrow, as you know, and we are looking to extend potentially the deadline. I know there's some excitement and still some companies who wants to apply. So we're looking at an extension. So stay tuned on the Gavi website to know more about that.
Yeah, thank you so much, Bertrand. I can see Lakshmana has raised a hand. Please, yes, you can talk. I've added you to the conversation.
Yeah,
Feel free.
are you able to hear me better?
Yes, I can hear you. Hi,
Yeah.
hello.
It's a very informative and very useful presentation. Can we get a copy of this recording so that we can go through it?
Should I let you respond to that one, Sheila?
Yes, absolutely. We are going to be sharing this with you, everybody that registered on the call. We are going to add it to YouTube because we are getting a lot of questions regarding the call for application, just to understand how wide this scope is. It's not as niche as it sounds. So we're definitely sharing this with any and everyone who would like to view it. Also, please share it with your network if there's anyone you think would be a good fit for this call.
Definitely, Sheila. It's a very useful call. Thank you very much. Your presentation was very lucid, very informative.
Thank you, Lakshmana. And to you and to all, don't be shy. Reach out to us, apply. We look forward to hearing more from you.
Thank you.
Thank you, everyone. So goodbye and have a lovely rest of the day. As I said, we're going to be sharing this with all of you. So you can rewatch and also share it with your network if you find, if you think it's appropriate for anyone else. So thanks a lot, Bertrand and Sarah. Thank you for
Thank you
telling
all.
us more about this call for applications and also about the extension. So I'm just repeating this in case you
Stay
didn't hear
tuned.
it well. There is an extension, to the call for applications. So please be on the lookout. We're going to be announcing it online as well. Thank you all and bye.
Yoshida, thank you all. Bye-bye.